Hello, thanks for inviting me. My name is Dr. Jesus Salatahuiza. It's a great pleasure and honor to be here. Today, I'm going to present a scientific article entitled Viruses and Lung Cancer Risks, Prevention and Treatment. This article addresses various risk factors associated with lung cancer, with smoking being the primary one. Other risks include exposure to asbestos, biomass used for cooking, environmental pollution, genetic factor, and chronic disease such as COPD, asthma, and HIV. Additionally, infections factors like Mycobacteria, pneumonia, and Chlamydophila pneumoniae are explored. Their article suggests that viruses such as human papillomavirus, Epstein-Barr virus, and Miles cold play a role in lung cancer. The COVID-19 pandemic has highlighted the elevated risk of infection in lung cancer patients, and there is a speculation about the potential oncogenic role of the SARS-CoV-2 virus due to the impact of the immune response and lung injury. Lung cancer in Europe. In the year 2020, it was estimated that 318,327 new cases of lung cancer were diagnosed in the 27 countries of Europe Union. 64% of the cases were in men and 36% in women, with the highest incidence observed in the individuals aged 45 to 69. The risk of developing lung cancer in individual age 0 to 74 is 1 in 19 for men and 1 in 37 for women. During the same year, 257,219 people died from lung cancer, with 66% of the disease being men and 34% women. Lung cancer is the leading cause of cancer-related deaths in men and their second leading cause in women in Europe and worldwide. The top three countries with the highest incidence of lung cancer were Hungary, Ireland, and Belgium. Regarding the incidence of death from lung cancer, the leading countries were Hungary, Poland, and Croatia. Viruses and their relationship with lung cancer. In the study by the Martel, approximately 2.2 million cancer attributable to infection were analyzed worldwide in 2018. The age standardized incidence rate was 25 cases per 100,000 person years, with Helicobacter pylori, HPV, or human papillomavirus, hepatitis B, and hepatitis C being the main infections agent related to cancer. While the molecular connection between infections agents and oncogenesis is well known in various types of tumors, such as cervical and stomach cancer, the pathogenic role of viruses in lung cancer is not fully established. However, evidence of viral DNA integration into tumor cell and epidemiological studies suggests a potential causal role of infections agents in malignant lung neoplasms. It is emphasized that smoking might increase the susceptibility of lung tissues to viral infection, affect oncoprotein function, and alter the immune response, as shown in mouse model studies. The article provides a description of virus oncogenic viruses, including human papillomavirus, Epstein-Barr virus, human immunodeficiency virus, cytomegalovirus, and Miles virus. These viruses have demonstrated oncogenic transformation capabilities in cell lines or animal models. Respect to HPV or human papillomavirus, human papillomavirus DNA virus is linked to the development of virus neoplasms in human, with type 16 and 18 responsible for 70% of HPV-associated cancers. the oncoprotein E6 and E7 of HPV or human papillomavirus stimulate cell proliferation, promoting the cell cycle and inhibiting apoptosis. A recent meta-analysis patient revealed that HPV or human papillomavirus was present in 13.5% of lung cancer cases, with type 16 and 18 detected in 6.1% and 3.1% respectively. HPV or human papillomavirus prevalence was 70.19% in squamous cell carcinoma and 9.2% in adenocarcinoma. Case control study showed a 22% increase in HPV or human papillomavirus infection in lung cancer patients compared to control regardless of the tumor state. Furthermore, another case control study evaluating the role of HPV or human papillomavirus in lung cancer examined the expression of viral genes, anti-cancer genes, and inflammatory cytokines in patients with HPV infections. In case control study, HPV DNA was found in 53% of lung cancer cases and 25% of controls, revealing a significant association with lung cancer. HPV-16 was the most common type in both groups, and increased expression of HPV genes was associated with a decrease in the expression of tumor-suppressed genes. Although these data support a potential role of HPV or human papillomavirus in lung cancer, the exact transmission route of HPV to the lungs is not entirely clear. Possible transmission routes from oropharyngeal respiratory pathways to the lung related to smoking, as well as hematogenous and inhalation transmissions are suggested. Further studies are needed to confirm these preliminary findings. Respect to Epstein-Barr virus, the Epstein-Barr virus, human gamma herpes virus 4, has shown an association with various cancer, although its relationship with lung cancer varies according to histotype and geographical location. It is particularly associated with subtype of lung cancer called lymphoepithelioma, like carcinoma, affecting younger non-smokers, especially in Asia. Although it respects less than 1% of lung cancer overall, it was also being found in other types of lung cancer, such as squamous cell carcinoma and adenocarcinoma. The Epstein-Barr virus undergoes two stages in its life cycle, one of latency with the expression of the latent proteins, and another lytic with the expression of lytic proteins. The initial infection, often asymptomatic, allowed the Epstein-Barr virus to establish a lifelong persistent infection in memory B cells. Various studies have detected EBV DNA in intensive care patients, immunosuppressive individuals, those with chronic lung disease, and notably in patients with COVID-19, suggesting reactivation even in cases of immune system dysregulation. A study on patients with bronchiectasia showed that those with EBV DNA experienced a faster decline in lung function, a shorter time for the next exacerbation, suggesting a possible relationship between EBV or Epstein-Barr virus and the progression of bronchiectasis. This data indicate that Epstein-Barr virus latency EBV or Epstein-Barr virus latency could facilitate the progression from chronic lung disease to lung cancer and vice versa. And previous cellular alteration are necessary conditions for establishing latent EBV infection. Respect to human immunodeficiency virus or HEIV, The article emphasized the higher risk of developing lung cancer in people living with HIV, attributed to factors such as the dysregulation of the pulmonary immune environment, chronic immune activation, and persistent inflammation. A French study indicated that the risk was linked to the inability to record CD4 counts of approximately 500 cells after the initiation of antiretroviral therapy. Another study in the USA showed that recurrent lung infection were associated with an increased risk of lung cancer after 10 years from the onset of its factors such as CD4 lymphocyte counts, factors such as CD4 lymphocyte count, previous its diagnosis, lung disease, age, education, and cigarette smoking were associated with an elevated risk of lung cancer in people living with HIV. Additionally, studies identify overexpressed genes and represent genes in lung cancer cells in people living with HIV, opening avenues for the use of genetic biomarkers in the early detections and monitoring of lung cancer in this population. Respect to cytomegalovirus, the cytomegalovirus, herpes virus with high global prevalence, remains latent in epithelial cells, endothelial cells, and macrophages after initial infection. The involvement of cytomegalovirus in lung cancer is related to oncomodulation through oncogenic proteins PUL123, PUL122, and PUS28. Cytomegalovirus persistence and reactivation lead to chronic inflammation, genomic mutability, and immunosuppression factor associated with the initiation of neoplasms. A study on malignant pleural mesothelial revealed cytomegalovirus IgG in 51% of cases, with 79% showing cytomegalovirus DNA anemia. Cytomegalovirus DNA was found in 48% of tumor compared to 29% in pleural tissue samples from early individuals. Although cytomegalovirus has been detected in virus epithelial tumors, there are no reports establishing a direct relationship between cytomegalovirus and lung cancer, despite its presence in tumor of other organs. Respect measles virus. Measles virus has an affinity for lymphocytes and also shown a preference for the oropharyngeal epithelium. Acute measles virus infection is usually followed by temporary cellular immunodeficiency despite providing lifelong protective immunity. A study identified measles virus P53 and RIND-H2 antigens induced by P53 in the majority of non-small cell lung carcinoma cases. Patients around 60 years old had higher levels of measles virus antigens, and the analysis showing an association between PRH2 and survival, as the accumulation of PRH2 leads to negative regulation of P53. Prevention and treatment of oncogenic viruses. Preventing infection by oncogenic viruses, except for human papillomavirus, for which vaccines exist, is a challenge. Although there is not evidence supporting a reduced risk of lung cancer in individuals vaccinated against human papillomavirus, post-infection strategies are proposed to block or reduce oncogenic transmission. In the case of Epstein-Barr virus infection, smokers are suggested to keep smoking as a primary prevention measure for upper respiratory tract carcinoma, including lung cancer. Phase 3 clinical trials are underway to evaluate drugs that activated the lytic phase of Epstein-Barr virus or vaccines against this virus, especially in the context of neoplasms carcinoma. Furthermore, biological therapies such as the use multivirus specific T cells are being explored in patients undergoing allogeneic stem cell transplantation with new or reactivated infection by cytomegalovirus, Epstein-Barr virus, or adenovirus. These strategies call for future treatment for patients infected with oncogenic virus. Regarding SARS-CoV-2, it is certain that the COVID-19 pandemic has had a significant impact on global health, and despite rapid reshare, the complication and possible long-term consequences of severe SARS-CoV-2 infection are still unknown. The possibility of oncogenic mechanisms of the virus in the development of lung cancer has been raised, included lung damage and fibrosis, hyperinflammation in several patients, and no regulation of angiotensin-converting enzymes too. The author concludes by stating that the role of viruses in the development of lung cancer is not yet entirely clear, but there is epidemiological support for infection in tumor cells, although basic research studies have revealed possible oncogenic mechanisms of viruses in lung cancer cell lines. More research is needed. In addition, it is suggested that smoking may contribute to viral oncogenesis by inducing local immunosuppression and easing viral pathogenesis. Thanks for your attention.